beverage under here? What time we got? Oh, we're getting there. I guess my mic's on now. I don't think it was on before. Yours, they won't turn yours up until they think, again, like if they think you're gonna talk, when you move your microphone to your face, then they'll turn you up. So wait a second before you say something. They do a good job with that, but sometimes there's just a little pause. What do we got? What do we got? 2 minutes? 3 minutes? Oh. We're so far ahead of time. Yeah.
Just stand here and have riveting conversation and let everyone wonder what.
Good afternoon, everyone. Welcome to the Columbus Metropolitan Club. CMC connects people and ideas through community conversations at forums just like this one nearly every week. I'm Deb Hackathorn, the Government Relations Principal with Frost Brown Todd, and I'm also the proud chair of the CMC Board of Trustees. For those of you joining us today by live stream, we're coming to you from the Ellis in Columbus's historic Italian village. Welcome, everyone. If you scan the QR codes at your tables, you can learn more about today's forum, take a short survey, and see the many organizations that support your not-for-profit Columbus Metropolitan Club. Thank you to today's forum partner, WOSU Public Media. Thank you to the presenting sponsor of our live stream, the Center for Human Kindness at the Columbus Foundation, and our live stream partner, the Columbus Dispatch. And thank you to the Ellis for hosting us. Every CMC forum takes a village. Please join me in thanking everyone for their support today. And now welcome to today's forum, the Caregiver Crisis. There's a growing focus on seniors and the care they need, but far less attention is being paid to the family members who are often providing that care. According to AARP, in 2010, there were 7 potential family caregivers for every person over 80. By 2030, they expect that ratio to drop to 4-to-1, and by 2050, it'll be less than 3-to-1. In partnership with WOSU's Inside Caregiving initiative, today we welcome leaders and advocates to explore how we can overcome this caregiver crisis. It is now my great honor to welcome our panelists today. Please welcome Jenny Carlson, State Director of AARP Ohio, Katie White, Director of the Central Ohio Area Agency on Aging, Shonda Wingo, Director of the Franklin County Office on Aging, Dr. Kathy Wright, Associate Professor and Senior Associate Dean for Faculty Affairs at The Ohio State University's College of Nursing. And finally, our host, Anthony Padgett, General Manager of WOSU Public Media. Thank you all for being with us today. Anthony, I'm turning it over to you.
Thanks, Deb. Good afternoon, everyone, and thank you for joining us for this important discussion around caregiving. No doubt many of us have personal experience with this. That seemed to consume our conversation earlier at our table. If we could just take a moment, if you don't mind, if you've had personal experience or helped someone through caregiving for someone in any way, shape, or form, could you please raise your hand? I think that's everybody, almost everybody in the entire room. So it just kind of goes to show you how widespread and how reaching this is. As we know, the need for caregiving is growing, but the number of family caregivers is shrinking. We have an outstanding panel of experts with us today to explore these challenges, opportunities, and the potential solutions for supporting caregivers in Ohio and beyond. So let's dive right in. To start, let's talk about the big picture. The caregiving gap is widening, with fewer family members available to provide care for aging adults in the coming decades. Not to mention that many of those are likely caught in the middle, also providing for care for their own children. So Jennifer, I'm going to start with you, and I'd like to ask, where do we start? What's our starting point for this in addressing this shift from a systematic level, not just putting a Band-Aid on it?
Sure. Thank you so much. I want to talk about 3 areas of interest. That's education, activation, and innovation. Within those areas, there should be a three-pronged approach. We need to pursue legislative changes, public policy initiatives. We also need to make sure that we're shoring up our workforce, as well as supporting our community-based services. I want to first touch base on education. We need to normalize caregiving. It is society's obligation to make sure that we're embracing it. It's not a personal burden. And I think that's really important to note, because there's so many individual caregivers out there where we need to come together as a society, support each other, talk about it, talk about intergenerational living, which in fact that's what I'm doing and practicing today. I'm a caregiver. And then we also have to talk about, what do we need to do around workforce? What can we do around career ladders? How can we invest more in workforce practices? Innovation technology is super important. We need to shore up our telecommunications, telehealth visits, maximize AI. That is incredibly cutting edge, but we also need to do it in a way that is informative and safe for our caregivers and loved ones at the home.
Very good. Anybody else have any
If
thoughts?
I want to piggyback off of that, when we talk about caregivers, you bring up an excellent point. But I also have recognized that many caregivers don't identify themselves as caregivers because they're just doing what they believe is what they're supposed to do as their birthright. So to piggyback off of what you say, I want to kind of define, caregivers so that those who have not already identified themselves know that I'm talking to you. If you are making doctor's appointments, if you are following up on medicine, if you are stopping by a senior's home a few times a week just to say, hey, how you're doing, those small tasks is where caregiving starts. So if you're doing that, you are a caregiver. There is a spectrum of caregiving, obviously. I think oftentimes when people are looking outside, looking in, they think caregiving is in the home 100% of the day, but there are steps to being a caregiver. So I just wanted to first level set so that people that are in that space, when they want to be seen or they need to be seen, first you have to identify yourself as a caregiver.
That's a very good point, Shonda. And I think one of the things that goes along with that is you're often doing these tasks without the training that other professionals have to do those tasks. You're just learning as you go and kind of working through it. So thank you for that reminder as well. Every little task can be a caregiving, a task associated with
and it's all time sensitive, we need our employers to come along with us in this journey. If we've seen some enhancements, but there's still a lot more that employers can do to support caregivers, whether it is extended leaves or whether it is extending the family paid leave policy. But it's just being able to have that flexibility to caregive and work and be a mom and all of the capes that we wear every day.
Kathy.
Add to that sometimes we feel like, especially when it comes to policy, where do we begin? What do we do? How we can make changes? And we have to remember that stories are powerful. So if you have your own personal story of caregiving, if you have a friend or family, talking to your legislators about the stories, the experiences that you have are very powerful. So don't underestimate the power that you have as individual caregivers.
These are all really great points, and I still want to stay on finances. And so it's really important to note that as family caregivers, we know that 1 out of every 5 voters in the state of Ohio identify themselves as being family caregivers. 78% of all voters, and that's 18 and older, are either family caregivers, have been family caregivers, or soon will be family caregivers. And it's really important to note that there's a swelling ground movement of raising awareness. But I do want to talk about out-of-pocket expenditures. For all of the caregivers, including myself, we have significant out-of-pocket expenditures, and on average, it's about $7,200 a year. That's a big chunk of money coming out of your annual pay. For our veterans, for individuals with dementia, it's significantly more. And so we do have some solutions out there, like the Credit for Caring Act, that our local congressman, Mike Carey, is sponsoring, and that's a top priority for AARP. We're driving that at the federal level. We need help to pass initiatives so that individuals have the financial relief. Working individuals providing care to their family members so that they can offset those costs around respite care, adult daycare services, how to build out home modifications. And so I would all encourage you to look at the information on your tables. I brought information, there's a QR code, engage. We'd love to hear from you. We are collecting stories so that we can send information back to our members of Congress so that they know how important the Credit for Caring Act is for the state of Ohio.
Can I add one more part to that too, just to tie some of the pieces together? When we think about caregivers in the U.S. and family caregivers specifically, 60% are women. And when we think about whether it's lost wages or out-of-pocket wages, that accumulates over time and then throws caregivers even into a financial challenging position for themselves as they age. So I wrote down something around Generations United says that leave of workforce for caregivers doubles the chances that women end up in poverty. And so it's not just the emotional and the financial, it's also our future that we're talking about, depending on at what age that you become a caregiver. And so making sure that we tie together the research, the evidence, the policies, and the leave is going to be really important, especially as so many more of us are becoming caregivers.
And Shonda, I really appreciate your CAPE comment, because just as we're hearing, caregivers are superheroes, so it's very appropriate. One of the adages that we've often heard is continuing to do the same thing and expecting different results is often the definition of insanity. It's kind of unrealistic to expect that. And so, Kathy, one of the things that I was thinking about is what are some of the things that we should be preparing to do differently? Are there any innovative models or other states or countries that we should consider adopting or looking to from Ohio to improve our caregiving support?
Thank you. Great question. So there is a program that's covered by CMS. It's called GUIDE. And what GUIDE is, it's a program where we are creating a better experience for caregivers, especially caregivers of people living with dementia. And there are various clinics and also outpatient centers that do have this guide program, so that when you go to a doctor's appointment and one of your loved ones or family member is having problems with their memory, it's not just dismissed as, well, you know, grandma's 80 years old or 90 years old, this is expected. And it's not expected that our memory and our thoughts should decline as we get older. So that's one of the very innovative models that is out there and is actually available here in real time. There are other things that we're doing also with regards to how can we improve the health of the caregiver, because as mentioned by our panelists here, that we're all touched by caregiving in one way, shape, form, or another. So how do we keep ourselves healthier? So some of the work that I've been engaged in particular is how do we keep African American women healthy as they care for their loved ones who have a dementia, because we know that unfortunately, as a person of color, we are twice as likely to get dementia than any other group. And also, the care that we provide tends to be even more intensive. So my message is always, self-care is not selfish. So things like making sure you get sleep, allowing people to help you so that you can have the opportunity to take care of yourself, because then you'll caregive for a much longer period of time.
I'd like to share one recent change that occurred in Ohio. So effective October of 2024, individuals that are eligible for home and community-based waiver services can participate in something called structured family caregiving. So this is new to Ohio, but essentially if you're a caregiver and you are caring for and living in the home of someone that's on one of the waiver programs that COAAA case manages, you can be not only reimbursed financially for your work, but also you can now have access to ongoing case managers, support, technical training. So we're really starting to roll this out across the region. And I think that is something to be stood up and to be shared, because I think it has some real promise in doing what we know is needed in supporting not only financially, but emotionally caregivers.
Have the power from the seats that we sit in to drive policy changes just within our own practices. So for kind of piggybacking off of that, you know, what we've done at the Office on Aging was amend our contracts to allow family members to be those paid caregivers through the providers that we partner with, because we realize that caregivers are doing it for free. They just need a place to plug in so that they can continue to caregive, but also receive some financial relief. And that was a change we made 2 years ago.
Those are all really important. We know that family caregivers spend about 1.4 billion hours in Ohio providing structured family caregiving. And that equates into about $21 billion of unpaid labor. And what you had mentioned about structured family caregiving, it would be really great to take a program like that, make sure our publicly funded, government-sponsored programs, as well as private insurance, embrace that type of flexibility, because it doesn't exist across all insurance policies.
So let's keep this part of the conversation going for a moment and look at a couple of different things. We're talking about, you know, kind of some of the burdens that caregivers face. And so if we could focus a few minutes on those that experience burnout, the type of stresses that they're under and the financial strain, which we've already started to talk about. What are some of the other resources? You know, what are the biggest financial challenges faced by those, not just the caregivers, but also the seniors that might have to be accommodated for? And what resources currently exist to support that in Ohio that you would like to point people to?
I'm happy to start. I just wanted to start out with my why. Take you back 5 years ago, my mother, Penny, I do need to say that she's happy and healthy right now, but she wasn't 5 years ago. 81 years old, presented with heart attack, stroke. We made the very hard decision as a family during the pandemic to sell my mom's home it was my daughter's senior year. We moved 15 minutes away out of school district, moved my mom into a safe environment where she could have that independence and co-live with us, but also moving in with my husband. And so it was a big family change. But resources, it is so important because I do find it, from a caregiver's perspective, it's a complicated web of resources. There's rich resources out in the community through our area agencies on aging. The Department of Aging has, tremendous resources, systems, and supports. AARP, your nonprofits, have a lot of information out there that I would encourage everyone to become informed advocates. Dig deep. Look at our websites. We have a toolkit that details out how to become a caregiver, resources that you can lean in on, how to connect in the community, and then some of those tough issues about transition of care. You might be living healthy now, but at some point, as you go further down in the longevity, aging, your situation will change. And then we've got tools on our website, everyone can have access to it, how to cope, how to connect, and how to find resources.
So,
Do you want to go?
oh, just a quick addition. Do not forget the Veterans Administration also. Personal story with my mother-in-law, who is 93 years old, will be 94 in May, and lives in assisted living, has some memory impairment, some dementia that we were able to identify that because her husband, who had passed many years ago, was in the Korean War, that she actually had some benefits that she could utilize to help towards the cost to cover assisted living. So I definitely encourage you to look at all the different avenues that you have out there available for resources that you may or may not think of.
So I mentioned earlier this roughly $7.5 million that come into the region every single year, and I want to share a little bit about how those funds go into the hands of caregivers and care recipients. So we have county partners in each of our 8 counties. The Franklin County Office on Aging is one of them. Licking County Aging Partners is here. Delaware Source Point, some of those agencies you've likely heard of. So we have 2 individuals that are licensed and specialists that can answer those calls about information and assistance to do some one-on-one counseling. And then what we'll do is make sure that we're tying you into those local resources, like our different county aging partners that receive the funds for things like home health, homemaking, adult day, Meals on Wheels. And so, of course, I'm always going to say, no matter where you are, call your area agency on aging, because if we don't provide it, we certainly will get you to someone that does. And so I just think knowing that there are funds at the federal level that come all the way down into your home are super important. And then each of our county offices on aging also then have levy dollars that can supplement and can fill in additional services too.
It's a great partnership. I think our partnerships are a microcosm of how caregiving really is, right? My boss, DCA Bivens, coins this phrase like, if you have peanut butter, I have jelly, and you have the bread, we come together, we make that peanut butter and jelly sandwich. And that's really what caregiving is going to be and needs to be. But I want to encourage everyone to know that we're throwing out a lot of resources. We're talking to you about who to call. We're trying to encourage you to think differently about your caregiving role. Just know that you're never gonna have all the answers, and that is okay. Keep asking questions, keep reaching into us, because no 2 caregiving journeys are the same. You can probably sit and try to be the best planner, plan every single detail, and something will come from the left that you weren't able to think of. And so give yourself some grace. But the important part, first, like I said earlier, is recognize that you're a caregiver. Thank you for doing that. Second, you're never going to have all the answers. The key is to keep asking questions.
very good reminders and about asking questions. It's often, this is a pretty dynamic area, especially when you've got care going in multiple directions, but you're also trying to work and you're looking at that future that you mentioned. What do you think are some things that workplaces could do or that caregivers could ask their workplace for that would make things a little easier? Whoever wants to start, jump in.
I'm happy to start. Workplace flexibility, making sure that employers are providing time off for caregivers, making sure that you are taking your time to take your loved one to your wellness visit, making sure that you have the respite time as well. I wanted to go back to the Credit for Caring Act because this is a terrific way where we can put money back into the pocketbooks of caregivers, having employers support this because this is for working caregivers. If we support this legislation, working caregivers can claim up on their federal taxes up to $5,000. That's 30% of what they're paying out-of-pocket costs. They can bring money back into their pocketbooks. So that's a really good way. And then also working on career ladders, making sure that employers are being thoughtful about how to support, how we can bring in more training as a loved one. I mean, we have an aging population. And how great would it be for HR within the employer community to be able to share strategies, tactics, information, making time to connect in the community so that they can further promote resources that you're entitled to.
Anybody else have anything to add to that one?
So I just wanted to add, too, that in addition to having that maximum flexibility as caregiving, I think that organizations can help to provide some guidance with regards to care planning and really thinking through what are some of the things that you might need even before you need those things, and preparing people. I know oftentimes we don't do enough when it comes to preventative and preparing for caregiving, because as we mentioned, pretty much everybody in this room at some point is going to be a caregiver or need care themselves. So I think that if our institutions, organizations, and employers could provide those additional benefits, that would be helpful.
Can I mention one other thing? We know that 48% of family caregivers in the workforce have stepped out because of caregiving needs. And so it really is incumbent upon the employer community to look at better strategies to help their employees.
Healthy workforce and healthy people. Kathy, I want to circle back to something you mentioned earlier. You brought up some of the disparities and how certain things affect different populations differently. What are some of the most significant racial, ethnic, and socioeconomic disparities that we see in the elder care system today?
So in the elder care system, what we see in terms of disparities, in terms of differences, are particularly in chronic conditions. Oftentimes as we get older, and especially for minoritized and underrepresented groups, we have more chronic conditions on top of having dementia, so congestive heart failure, hypertension. That's one of the #1 conditions that we deal with in regards to trying to prevent dementias, as well as disability. One of the things that struck me the most when I began my research journey as a clinician is that even at a younger age, that individuals who are minoritized have more chronic conditions and disability than our European American counterparts. So.
Anybody else?
We're going to say something? Okay. So I just want to highlight the need for data, for research, for creating evidence-based programs. Our systems and what we know now have not necessarily been based on truly understanding the needs of everyone, right? And so we need to have partners like you, like the Age Friendly Innovation Center, who are setting up these inclusive opportunities to come to the table, to complete surveys, to share what individual needs are. And so only by knowing and listening and truly having inclusive research and planning processes can we ensure then that our funds and our programs and services make up for those disparities.
Kind of bridging that gap and filling it in. And the other thing that's come up a couple of times in our conversation today is technology. I believe someone mentioned AI specifically, so this is a question I suppose I should ask ChatGPT, but I think you might have a better answer than that. How does access to technology or technology advancements affect the caregiving experience? Help it or hinder it? You know, we talk about telehealth, AI-powered home assistants, wearable devices, and things along those lines. How can all of that contribute or hinder the caregiving experience?
It can contribute significantly. I mean, we've got wearable devices where information is going directly back to your practitioner. You've got family loved ones that could go to work, monitor their family members at home. We even have electronic medical records, which are terrific, where we can communicate directly with our provider. Where we have a challenge is the technology divide. We have many consumers out there that do not have smartphones, do not have email addresses, do not know how to navigate those electronic records. This is personal experience for me. My mother is not tech savvy, and so that is one thing I do as her personal caregiver. I communicate with the medical folks. I take her to her appointments. We at AARP, we're very focused on making sure that we're narrowing that digital divide and helping with broadband activities, going out in the community, teaching the aging population, how do you navigate your phone? How do you get on your electronic records? What can you do at home? But technology is incredibly important.
Okay.
I was just going to say also that don't be afraid of technology. AI is not all bad. There are studies that are being conducted regarding companionship because we know that loneliness, isolation, those are some of the #1 causes for dementia because you're not engaging with people. There's some research that we're conducting at Ohio State and the College of Nursing where we're actually using little robots, little dog robots to interact with people that have dementia and play games with them and communicate that way. So don't be afraid of technology. The other thing that we've done too that's been interesting in terms of technology is actually bringing it into the home setting to where we can monitor the caregiver's responses to stresses and then provide real-time immediate feedback to caregivers on how to deal with difficult situations. So don't be afraid of technology. Be aware, but don't be afraid.
There's so much to say about digital equity and what is happening in Franklin County. I want you to know that seniors are using AI thanks to one of our programs with Level Up Land, where we introduced a gaming initiative to the community, and Miss Pam here's clapping because she's a vet. But there are innovative ways to get seniors connected and their families connected. And what we were able to see with the gaming initiative, and when I say gaming, yes, seniors were playing video games every week, and they love it. Quote Miss Pam, she said, "We're back in the game." And so using that AI, we've also took it a step further in teaching seniors how technology can allow them to connect. When we talk about social isolation, we know that social isolation reduces life expectancy. It's equivalent to smoking 15 cigarettes a day. So using a story, there was a senior who we've worked with who didn't really have much interaction. She joined the program, she started to come out. She then purchased a membership to the game arena, and she goes on her own, but even beyond that, her family now plays video games with her, which is a social connection that she didn't have before. And so when we take that step to teach seniors or connect them of how the technology is relevant to their life, that allows them and their families to embrace them more. So I just wanted to share that.
And the relevancy to the life, I think, is so key. I recently had a conversation with a dear friend whose mom was diagnosed with Alzheimer's, and just the beginning stages of how to navigate and what it all means. And One of the things I made sure to drive home was that your mom is still your mom. What does she like to do? What technology might you use to make sure she can still do that without taking away autonomy, without taking away independence, but working together to say, you know, how do we make sure that you can continue to do the things that you like to do on your own or with support? And so there are lots of different ways to add in technology at different phases. And I think we can all agree that we need to make sure we're working with the person that we're caregiving for to make sure that it's in conjunction and meets what their needs are too.
That's true. Sharing more details. There were seniors who came through that program, one of which was an avid golfer, but due to physical limitations wasn't able to golf. He's now able to resume his love for golf through the video game initiative. Another senior wasn't able to drive anymore. He loved driving. He's now able to relive that joy by driving in the video game. So you're absolutely correct.
And of note, I did go and personally experience and met Pam, and it's an exciting program, and we've got to figure out how we can work together to take this outside of Franklin County and beyond.
By the way, Pam, I love your shoes and your hat. And the fact that technology conversation's full circle back to connection, which is what really matters and one of the most important things. And keeping those connections is extremely important. But looking ahead, we know that caregiving is going to continue to grow to be a major societal issue. How can we better prepare younger generations? I believe somebody mentioned earlier that, you know, it's one of those things that you've got to see it as this. It's not taking away anything. And so how do we better prepare this younger generation for that responsibility, and what types of education and resources should we be providing them? You can start.
Okay.
Sorry.
Go ahead.
So one of the things that we recognize is that connecting young folks to our seniors is very important. Those are the two of our most vulnerable populations in our society. So the first step is that intergenerational programming, bringing seniors and young people together and teaching our young folks the importance of that community and connecting. So at the Office on Aging, what we've done for the last few years is what we were like a one-day technology drop-in where we were using students to work with the seniors. And oftentimes they would come with simple questions. I just want to know how to unfriend somebody on Facebook. And these are the things that they're dying to know, but don't take priority because they feel like they're inundating their family with all of these questions. And so creating those spaces where young people can connect with seniors has been critically important. Most of our young people at the commencement of those events will say, I feel like I have a new grandmother, or I feel like I have a new grandfather, and vice versa. So it doesn't have to be, you know, an overemphasized program. It can be just as simple as figuring out how to bring the generations together, because then what happens is those young folks go back to their schools, they go back to their communities, and they figure out other ways to contribute in celebrating our seniors. So in that, it just happened, because we've been doing this for about 2 years now, some of those youth programs reach in and say, hey, we want to do a Christmas party for the seniors. How can we do that? Or hey, we're earning these internship dollars. How can we take our money and do something nice for seniors? So that's one way. It's just simple as just bringing them together, and that opens up the young mind of how they can contribute to caring for young folk or older folks. The other thing is, and what I do with my sandwich household, I have an 18-year-old, a 16-year-old, and a 10-year-old, and I talk to them all the time about who's going to take care of me. So I'm planting seeds now, and it is not too soon. And whenever I see a grade that doesn't fit my life plan, I'm like, how are you going to take care of me? We need you to get that grade up because we got to figure this out.
I think what's great.
We need to start way earlier, educating our early learners about the importance of caregiving, family caregiving, intergenerational programming activities. We know there's a workforce shortage. We have an aging population. We need to incentivize. We need to create opportunities throughout high school to do those experiences with our younger generations out in the communities. We also need to work on career ladders, because once you get out in the workforce, we need to make sure that we keep them engaged. So it's expanding opportunities in high school, starting earlier, working with the higher education community to make sure we have the bandwidth and we continue to offer programmatic solutions, and then bringing up unique programs like certificates, other ways we can reach higher education, working with community colleges so that people are trained up and being able to offer services out in the community in a unique way.
Just wanted to add another thing too. You had mentioned earlier about innovative programming, and with regards to bringing in the whole family system in caring for their loved ones. There's a wonderful program that's out there. It's called Alter Dementia. One of my colleagues, Dr. Fayron Epps, has developed this program where they go and come and work with the churches in order to engage the family with regards to how can we even create church services and events for our seniors that are able to engage actually actively in the church services, and that also adds to that socialization, as well as adding to bringing the whole family into the caregiving responsibilities and roles and enjoyment too.
And I'll add, that the exposure and the education at all of these different ages is so important, making sure that the opportunities are reciprocal, right? And it sounds like the examples that you gave are perfect, right? It's not just that one needs help and one is giving help, right? We're both benefiting from this relationship. So at a younger age, also we need to make sure that our education and information that we're sharing is not ageist, right? We don't want to continue to sort of other older people and make this seem like it's something that, people shouldn't want to age. We need to make sure that that's front and center. And then outside of K through 12, we also need to be looking at different types of internships and different types of opportunities, because we know from the research that exposure to working with older adults oftentimes lends itself to individuals then being interested in careers in aging.
Very good. And what I'm hearing, and I think one of the themes that we've heard today, is much like having a CMC event, it takes a village. And by the way, speaking of a village that we have in this room with us today, it is now the interactive part of the program for this afternoon. So it's CMC's longstanding tradition to take audience questions. We'll now move to questions from the live stream and in-person audiences. And if you have a question, please make your way back to Doug right there where the microphone is at. And if you're online, please go ahead and feel free to start typing those questions in. Doug's going to curate those for us. And so Doug, I'll now throw it to you to go through the questions we have both in the room and online.
Anthony, thank you very much, and thank you to today's panelists. Speaking personally, this is a great conversation. I've been there myself, so thank you so much for sharing all the wisdom today. If you have a question for today's panelists, please do join us here at the microphone. And to Anthony's point, if you're watching online, type your question in the chat. We will try to get to as many questions as we can with the time we have remaining. Great questions at CMC always have two things in common, right? They take less than 30 seconds to ask. And what punctuation mark does a question end with? Question mark. A question mark. Always good to keep that in mind. Thank you very much. So here's the first question. Can you speak to recommended resources on activities for daily living for caregivers? Maybe that's a website or other online resources, but resources for recommended activities for daily living for caregivers.
So I'm happy to take that on. If you go out to our website at AARP and you have the information resources at your table, we have all kinds of structure, programmatic activities, down from yoga to healthy eating to how can you connect in the community, how can you join social activities. And so I would encourage everyone to come to our AARP website and learn more about what we can do with you in the communities.
I'll add to that as well. I'll take a little bit different interpretation. If the person is asking about support for helping the person they're caregiving for, I would say definitely visit the Area Agency on Aging website. We've got lists for whether it's help with meals, homemaking. If you live in Central Ohio, we've also invested in something called Trualta, and you can join that for free, and there's a huge list of resources all around how do you bathe someone, how do you get them dressed? And then, of course, all of the county partners, too, have a lot of resources specifically related to that.
We produce a monthly newsletter where we collect information across Franklin County, including what we do. So there's a lot of activity that are specific for caregivers, but also specific for the seniors. If you're interested in receiving that from us, just access our website at franklincountyofficeonaging.org or give us a call at 614-525-6200. But it is a monthly newsletter. We put it all out there. We're heavily engaged in having activities too, so we will let you know the calendar of events, and you can just pop up whenever you are free.
And just real quick, remember checking in with your provider because whoever might need those assistant activities may need physical therapy or occupational therapy, and those are all things that could be covered through insurance and through Medicare.
Good afternoon. I'm Kathy Fox with Community Strategy Partners. My question has to do with the recent shutoff of federal funds for signed contracts and grant agreements. I've read that at one end of the spectrum, Head Start early childhood education centers are closing across the country because they're not receiving their contracted funds. Are you seeing anything similar with any of the services that your constituents rely on?
I guess I'll take this one. Okay, so what we know for certain through our colleagues at US Aging who are in DC and who are, really monitoring this closely is that the pause is on pause. I, along with many others, probably read that the Ohio Department of Medicaid website was down for a period of time. I did hear some of those websites were down. As far as I know, in written form from the advocates that are on the boots on the ground in DC, as of now, no funding is paused. We're not entirely sure what the future of all that is, but for now, I think we're sort of all collectively holding our breath to see what happens.
Hi, my name is Caroline Pfiffner. What can kids do to help their grandparents and older neighbors? Thank you.
That's amazing.
You're the best ever.
Oh, I love that. I'll take that because I have children and my mother is a grandmother and she absolutely loves when her grandkids come and visit and makes phone calls to her and, just connect. Make sure that you're connecting with your grandmother. Stay close to her because she wants to hear from you. I'm sure she loves you very much. And keep doing what you're doing.
I was just going to say that's exactly how I started my career in geriatrics as a little girl, going down the street and visiting my elderly neighbor and reading to her. So just doing things like that, simply reading to our elder seniors and engaging with them that way.
I'd also say asking them questions, learning from them, asking for their advice. I'm really lucky that my older neighbors generally are taking care of me and my kids, and they're shoveling my driveway. But just asking those questions about advice, life advice, telling stories, that's a really good place too.
To what I was kind of talking about earlier, and everyone is exactly right. I'm proud of you for even being here to ask that question because we're depending on your generation to be in this space. So thank you for that. But yeah, just call them or go visit them and ask them, what was life like for you when you were my age? They'll tell you everything you need to know.
Hi, my name is Beth Whitted, and each of you mentioned resources and connecting people to resources. Excuse me. Smart Columbus is developing a community information exchange, and so not just social service agencies can share information, but also individuals. Are each of you involved in those efforts? Are you familiar with them? Because I think that would be a really important place. Because I was hearing about resources. I've been in the community for a long time, and I was hearing resources today that I've never heard of.
We are. We're at the table. It is still in the works, and there are some challenges that have to be worked out around data sharing, but we are at the table and active in that process for Franklin County. Can't speak for my friends.
We will certainly look into that. I've got staff here that will take it back to the office and see how we can engage. Thank you for bringing that up.
Good afternoon, everyone. I'm a daughter, a mother, a wife, a physician. I'm a citizen. I'm a care partner. I take care of a parent who is living with dementia, and as a result, our entire family is living with dementia. I ask this question from all those perspectives and through that lens because I live that. It's difficult to search for resources when you're stressed, when you're sandwiched, when you're pressed like a panini, trying to navigate some of the typical issues that come along with caring for a loved one. And I'm hoping to get some information about any intentional efforts to help people plan on how to age well. Life happens. Aging begins way before you're 65, and it definitely doesn't end there. I'm just curious, are you doing any intentional work to get people at that point of planning? It makes a huge difference when you have a plan, and it makes a huge difference when you have a care team.
I'll take this on. And thank you for sharing your story. My mother, too, also has early on stage dementia, and it's really important to be able to connect with resources, figure out what type of care is available. We have a whole channel devoted to brain health, and there's early intervention, prevention, baseline assessments, training tools that I would highly encourage. I know you have my contact information. I can share that information with you. I would also like to say that this is a huge issue, a growing issue in the communities, and it is top of mind for me. It's a top of mind for the AARP. We are going to continue to work with our community partners to make sure we keep pushing out the AARP designation age-friendly. Age-friendly, this is a huge component. There's 8 domains, not to get super weedy, but this year in particular, we are going to make sure that we're locking arms with community partners, making sure that we're continuing to provide those resources, and we're doubling down on grant opportunities too. So if there are activities in your community, please, please, please look at those opportunities, because we are really, really interested in funding ways to make sure that we're connecting, providing services, and focusing on brain health.
The majority of the staff at COAAA, and we've got about 405 staff members at this point, are dedicated to our home and community-based services. But we have an entire shop, community engagement and outreach, that has education and topics like aging well, Medicare for basics, Medicare for beginners. So we absolutely have some of those proactive education opportunities, whether they're in our office or if you want to request someone to come out. So give us a call or check our website out. We absolutely have those opportunities.
The reason I asked that question is you have wonderful resources, but people don't know they exist. And that's really where that sweet spot is. And I'm trying to figure out, what do we do to help people be aware before they're in crisis, and how do we help them to do? I mean, does everyone here, for example, have a health care proxy, and does their family member know, for example, what's the code to the house to get in if something happens to you, or what do you want me to do if I have dementia? Most people aren't thinking about that, and so they're running to you, or maybe they don't even know you exist. And I'm just trying to figure out what can we do as a group collectively to make that connection happen for people.
It's conversations like this that once we all learn this information, you guys from the seats that you're in have the ability to share this information. Earlier, I was quoted as saying like this is a community thing. It is a community thing. We need each and every person to be active in this with us. If you have information, share it. Again, no two care journeys are the same. So there's other organizations as well, like the African American Alzheimer's Association. They actually have a web-based support group where caregivers can come together and talk, as well as the Alzheimer's Association as well, and they have a plethora of resources. And of course, the Franklin County Office on Aging, we work very closely with COAAA in that caregiving space, so you can also give us a call.
But your point is well taken and is absolutely true. We are working hard to get to individuals before a crisis, but oftentimes, people are busy, they're going about their life, they're not thinking about something until they need it. So any ideas you have or audiences, I'm sure I speak on behalf of all of my colleagues here, we absolutely agree. We want to be into audiences before the crisis occurs.
Well, everyone, I wish we had some more time today, but I'm getting the wrap-up signal. And before I go, I just want to remind you to take a look at this on your desk. As you can see, this is a very deep conversation. It's a very important conversation, timely and robust. And there's a lot more that we could be talking about throughout the next month. WOSU will be digging into this a little bit more through our Inside Caregiving project. So please tune in to catch up for more resources there. And now I'm going to turn it back over to Deb for some concluding remarks. Thanks, Deb.
Well, I hope, like me, you learned about a lot of resources that perhaps you didn't know about before, and you'll look forward to seeing that series with WOSU. Thank you so much for being here today, and thanks to our forum partner, WOSU Public Media. We are grateful to the presenting sponsor of our live stream, the Center for Human Kindness at the Columbus Foundation, and our live stream and promotional partner, the Columbus Dispatch. And of course, we want to show our sincere appreciation to today's speakers, Jenny Carlson, Katie White, Shonda Wingo, Kathy Wright, and our host, Anthony Padgett. Please make plans to join us right here at the Ellis next week, next Wednesday at noon, for When Safety Nets Shrink, a topic right out of the headlines. Thank you to everyone for being here. We cannot do this without you, and we hope you have a wonderful afternoon. Thanks.